tamoxifen, anastrozole, letrozole, exemestane. You've probably heard some horror stories about these medications. The side effect list of these medications is long, but obviously there's benefit to keeping you cancer-free. So what should you do? In this video, I'm showing you exactly what you need to know if you're thinking about stopping or declining one of these breast cancer treatments. I know you're suffering from side effects or feeling anxious about taking these medications, and there's good news. There is hope. Watching this video could be the difference in keeping you cancer-free. So let's dive in. Whether you're scared to start taking these drugs, thinking about quitting, or have already stopped taking these medications, this video is for you. Now, there are many side effects and benefits to hormonal therapy for breast cancer, but let's first dig into the side effects. Most medical professionals do not truly understand the life-altering side effects that these medications cause. Things like joint pain, hot flashes, weight gain, or vaginal dryness. These drugs can make you feel like you're not yourself anymore, and that's terrible. I know before I was personally diagnosed with cancer, I had no idea what my patients were going through. The side effects almost seem trivial. A lot of clinicians just simply think if you want to stay cancer-free, then you need to take these drugs. Unfortunately, they just simply don't understand how life-altering the side effects can be. That's why a lot of women are scared to tell their oncologist that they've stopped taking these drugs. But you don't need to be scared to share that here or with me. You honestly have my support either way. But before you make a decision, let's make sure you have all the right information. Now, not all women experience side effects on these medications. I don't want you to think that it's all bad news. There's also a lot of benefit of these medications, which we're gonna get into so you have a balanced view of both sides. But there's really no way for us to know if you're gonna have side effects until you start taking these drugs. If you choose to start and you get bad side effects, then you can always quit. It's really that simple. So there's not a lot of harm in giving it a try. Now, many women will suffer from side effects of these medications. That makes sense because we are significantly changing the hormone levels in your body. We're changing your hormone levels to unnatural states. You're bound to get side effects. But what your oncologist won't tell you, likely because they just simply don't have the time, is that you can manage these side effects. There are many women who come to the Cancer Freedom Program on the brink of quitting these hormonal therapies. They're scared because they know that this will put them at an increased risk of a cancer recurrence if they quit. But they also can't live like this anymore with all these side effects. The good news is that you can have the best of both worlds. The side effects of these medications can be completely managed and eliminated if we focus on your diet, your exercise, and your mindset. Now, many women will say, well, they already have a really healthy diet. And of course you do. But you can't be eating the same healthy diet that you did before you started these medications as after and expect to feel the same. Your body is on life-altering medications, and we need to adjust your diet to support that. It would be ridiculous to think that your body is not going to feel differently without supporting it in a different way. Now, for women that I work with in the Cancer Freedom Program, we specifically curate nutrition and exercise and mindset programs to resolve their symptoms in as little as 2 weeks. It happens that fast. So if you're suffering from the side effects of hormonal therapy, then the first thing that you need to do is support your body before calling it quits. You're likely able to completely get rid of the side effects. So to get support like that, apply for the Cancer Freedom Program. We're accepting applications right now, so click the link in the description and apply now. Okay, but what about the positive aspects of these drugs? So for women who have stage 0 breast cancer, the main benefit is to reduce the risk of a new cancer in the affected breast, and to a lesser extent, to reduce the risk of recurrence in the other breast. The benefit is pretty minimal, but most women watching this video are not gonna be stage 0 breast cancer. So for stage 1, 2, and 3 breast cancer, there is a significant survival benefit. This means if you take these drugs, you're actually gonna live longer. You will be less likely to die from breast cancer. I just wanna stop there and let that sink in. When some people say that they want a pill to make sure that they never have cancer again, well, this is it, or at least as close as we get. Now, of course, this is not going to work for 100% of women. You are not guaranteed to not have a cancer recurrence if you're on these medications, but they do make a significant impact in saving a lot of women's lives. Plus, they also reduce the risk of recurrence. Taking these medications will lower your risk of having to go through cancer and cancer treatment again. They are a powerful cancer-fighting option. And when we get the side effects managed, it makes taking these medications a pretty obvious choice. But if you don't have support in managing the side effects, then taking them can be almost unbearable. Now, it is possible to switch between medications to see if you get less or more tolerable side effects with a different medication. For example, if you're on anastrozole, and you have terrible joint pain, could you switch to letrozole and maybe have less joint pain? But when we look at the literature and look at women who try this switching method, we find that they're not any happier on a new drug. They either continue to have the side effect or they have a new side effect that's just as intolerable. They're actually just as unsatisfied as they were with the original medication. So in short, you're still likely to be unhappy even if you switch drugs. In some situations, I've seen women take half the dose or a lower dose of their medications. The hope is that they're gonna get fewer side effects. For example, if you take tamoxifen 20 milligrams, maybe if you only take 10 milligrams, you'll have less side effects. But we have no literature to show that this will work in terms of getting rid of your side effects or work to keep you cancer-free. Tamoxifen works by blocking a receptor in your body so that estrogen can't bind. So if the receptor's blocked, the work is done. It's kind of like a light switch. So lowering the dose might have absolutely zero effect. Plus, we have no literature to show that this drug will actually protect you against cancer at a lower dose. Because of this is just not a strategy that I suggest you use. Now, if you do choose to stop taking hormonal therapy for breast cancer treatment, there's a couple of things you need to know. The first is that these drugs do take a while to come out of your body. This means that even after you stop taking the drug, it's gonna be weeks to months before you fully feel like yourself again. So give yourself time and patience to get the drug out of your system and feel like yourself. The second thing that's critical to remember is if you stop taking these medications, then you absolutely need to implement a strategy to reduce your risk of cancer recurrence. Now, everyone should be using every possible strategy that they can use to lower their risk of recurrence. But if you decline or stop treatment, then this absolutely needs to be your focus. This can be hard though. I want to acknowledge that. Many women don't know which strategies will lower their risk of cancer recurrence, and more women don't know how to practically implement them. A new study in JAMA Oncology actually looked at 4 anti-cancer strategies that have been proven to be effective and looked to see how many cancer survivors were actually using those strategies. The results were shocking. Only 4% of cancer survivors were using all 4 strategies to lower their risk of a cancer recurrence. Strategies that you could start doing today to help keep you cancer-free. Accessible to you right now, but 96% of cancer survivors are not doing them. It's actually frightening. If you decline hormonal treatment for breast cancer, then you absolutely need to run after these 4 lifestyle strategies. That's exactly why I'm linking up this next video here. In this video, I show you exactly what these 4 lifestyle strategies are and how you can start practically using them in your life today. Time to lower your cancer risk. Click the link here and I'll see you in the next video.